So this is going to be a video demonstration of how to prime an IV line using sterile technique. The first thing that you're going to do is you're going to review the physician's order. You're going to be checking for the type and the amount of IV fluid, the rate of fluid administration, and the purpose of the infusion. You're also going to be checking the 6 rights of medication administration. So right person, right medication, right dose, right time, right route, and right documentation. After that, you're going to perform your hand hygiene. You're going to open your sterile packages. And you're gonna, so the first thing that I open is the solution. You're gonna check that first. You're gonna check color, clarity, you're gonna check the expiration date, and you're gonna feel around for any leaks. If that's okay, you can move forward to opening your tubing bag. So you would open your tubing bag, make sure that it looks okay as well. You want to maintain sterility on both ends. And you're going to set the roller clamp to closed. If it has another type of clamp as well, make sure that that one's closed too. And then you're going to remove the protective sheath over the port and the solution port. And this spike is sterile, so you're going to want not touch it at all. Keep it sterile. Then you're going to spike the bag by slowly inserting it and twisting it until it's in. Once that's done, you're going to hang the bag 90 centimeters, which is 3 feet, above the insertion site, and then you can start to compress the drip chamber. So I have no fluid in here, but we'll pretend. So you compress it about in the middle until it fills up to about 1/3 to half full. Once that's done, you're going to open the clamp to prime the tubing. So you're going to open the roller clamp so that it's open and that the solution starts to fill through the tubing. You're going to have the end of the port over top of a plastic bag or a sink so that the solution goes into there. You're going to, if it has valves, this one doesn't, but some of them have valves, you're going to invert them so that the solution goes through the tubing. And then the whole point is to ensure that there's no bubbles in here. So after this is open and it's flowing out, you can close the roller clamps, close the other clamp. If you still see bubbles, you can move through the tubing, flicking it to get rid of it. You can also open it a little at a time just to let the bubbles flow out. Make sure that there's no bubbles in any of the tubing. After the tubing is primed, you're going to close the roller clamp, you're going to close the other clamp. One last look, make sure it's closed. Then you're going to clean the catheter port with antiseptic wipes for 15 seconds. So the port at the IV site, you're going to clean that for 15 seconds. I also would clean this as the solution came out. So you're going to clean this port 15 seconds. Then you can attach the tubing to the IV site. The last thing that I would do is I would tell the patient not to roll over onto the tubing, as that can compress it and stop the flow of the medication, and just show them where their call bell is. If they have any questions, concerns, to give you a call, and you'll be back to check on them as per the order, physician's order.